Hello, everybody. Happy Wednesday. Welcome to this week's edition of Office Hours Live. I'm brought to you by your friends at the Wisconsin Veterans Chamber of Commerce. Today, we've got a really exciting show for you. We're going to be talking about COVID logistics, COVID vaccination logistics, give you updates on that whole scene. Our guest is Kim Bell. She's the chief of pharmacy from the Milwaukee VA Medical Center. So she's going to be bringing a lot of valuable, behind the scenes insights. That's going to be really valuable. But before I dive into any of that, I'm going to go ahead and hit this button here. That's going to have our new intro video that I'm sure y'all are pumped to see. So stand by and make sure to follow, as the video says. Check it out. Well, dang, that's pretty exciting, isn't it? Hot dog. I'm pretty motivated by that. And I see, I have the little ticker for the number of people up here that are watching, and the number of people just jumped up dramatically at that moment. So I would like to think that it had a lot to do with the intro video that I spent, I confess, way too much time putting together because I'm a complete novice at that sort of thing. But I'm happy for all of you to join us. Thank you for joining us on our live stream. And I'm going to dive right in and introduce our guest, who, as I mentioned, is the chief of pharmacy from the Milwaukee VA Medical Center here. So let me just press this button. Kim, welcome. Thanks for joining us.
Thanks for having me. Happy to be here.
Right on. Okay, but first important question. Did you like the video?
I did. It was great. Wouldn't have known you were a novice when you put that together.
That's what I like to hear. Checks in the mail. Well, let's jump right in, because I'm sure we could talk on this subject for quite some time. For those of you that have been living under a rock, there's this pandemic going on, and it's been going on for a year, and we're in the process of rolling out a vaccine that is hopefully over the next few months going to bring us back to some modicum of normal. Kim, I can only imagine your world over there at the VA Medical Center has been an absolute whirlwind. Give us kind of a rundown of what your world has been like, maybe over the last year, maybe last 6 months, and then most recently with the vaccine rollout.
Sure. Over the past year or so, as you mentioned, we've been dealing with COVID and everything that's come along with it, from all the patients we've been caring for and modifying protocols and everything to keep our staff safe, our veterans safe, and really provide the best care that we can for our veterans. So that was the last year or so, up until about 2 months ago, when everything seemed to kind of flip, and we've moved from this kind of just trudging through the pandemic and trying to get through each day to this real sense of hope that we've had with the vaccines. So since I think December 16th was the date that we were able to give our first vaccine here, we've been going full steam ahead and really trying to get, as everybody says, as many shots in the arm as we can each day.
Well, and I've noticed, so we've actually spread the word through our newsletter about a handful of, I noticed you've had the walk-in clinics for people that are of a certain age or certain at-risk categories. Have you had a good response and a good turnout for that? Is that the majority of where you see your recipients of the vaccine, or is it kind of spread out?
So it's a little bit more spread out. So with all of our vaccine administrations, we've been following very closely to the CDC guidelines. So I mentioned we started vaccinating back in mid-December, and those were really all employees to start with. So we had a scheduled process to hit our high-risk employees, both from the standpoint of those who were at risk of treating patients with COVID, but also those who were treating our patients who were higher at risk as well. So the first couple of months or month or so, we moved through all of our employees. And then, as you mentioned, we started with our patients by those walk-in clinics. I will say those walk-in clinics were probably some of the most rewarding days for me of work here at the VA. Just seeing all of the veterans come in and how excited they were. The first walk-in clinic day, I got here at 5 to start prepping, and we already had a line. It was almost like a tailgate party out there. People had their lawn chairs and their coolers, and everybody was just so excited and happy to be here. And I think we really fed off of that enthusiasm from everybody. So we did that for a couple of weekends. And we've now moved into more of a scheduled clinic. So all of our appointments are scheduled at this point. We've got efforts ongoing to schedule patients, reach out and schedule them. And we're also working on, if there's availability in our clinics, to get patients who are here for other appointments scheduled for a same day vaccinations. And the groups that we're focusing on right now is really our over 65. So that's really the next priority group that the CDC has recommended we focus on. And so that's who we're working on reaching out to.
And what do you think? And I know this is probably a guesstimation, but when is that age group going to start, you think, filtering a little bit down? Like when could a 36-year-old guy like me expect to get my shot in the arm, or my call to do so?
Yeah, so that's a hard one to answer at this point. We've kind of following the news, what we're hearing, initially we were hearing, maybe mid-April or so, things would open up a little bit more. And now they seem to be saying more spring to summertime, we might be in more of an open season for everybody to be able to receive their vaccine. We're monitoring where we are within our groups and how many of those over 65 patients have we been able to vaccinate. And, once we get through that group or feel that we're pretty comfortably have vaccinated most of the people in that group who want to, we'll look at starting to open it up then at that point.
And so are we talking that you guys have done tens or hundreds or thousands or tens of thousands so far? How many? And of course, this is again a ballpark, because I know you're still accumulating data on this and it's ongoing, but ballpark, how many people do you think have received that service through the Milwaukee VA?
So for veterans, we have vaccinated just over 9,000, and that's who have received at least one dose so far. And from our employees, we're just under 4,000 employees who have been vaccinated. So
wow, so you're
about 15,000 people in the last 2 months we have been able to vaccinate. That
is outstanding. How cool is that? And before I continue to ask questions, I just want to remind everybody that's watching that this is an open forum. So please, by all means, if you have questions, here it is, right from the source. We have the chief of pharmacy from the Milwaukee VA Medical Center talking about COVID, the COVID rollout, COVID vaccination rollout. So please throw your questions in LinkedIn or Facebook or YouTube or Twitch, whatever you're watching through, and I will just make sure to facilitate those and ask him so she can answer your questions, because now's a great opportunity to get it right from the source. So you mentioned a sense of hopefulness, and I just got to ask, I can only imagine what the vibe was maybe this last summer into the fall of, I don't know, I wasn't there, hopelessness. I don't know. Like, can you tell me just what this is going to be corny, just what a shot in the arm it was to your staff? Sorry, that was so lame.
No, it really was. Yeah. I still remember back to about 2 days into vaccinating the employees. I was sitting in a meeting, and our chief of medicine made the comment that the feeling in the ICU, the mood in our ICU was just different. Because people were starting to be vaccinated. There was that sense of hope that we were entering a different phase at that point. We knew we all have a long road ahead of us. There's still a lot of work to be done, and we're definitely not out of the woods yet. But this was the first time that we felt to be on that path to getting out of this and getting back to some normalcy. I mean, we've joked that the employee vaccination room where we were administering all the employee vaccinations was the happiest room in the hospital. Everybody was excited to be there, happy to get their vaccine, and so it was really a pretty cool experience over that first month or so. And I think what's even more exciting is now that we're able to move on to veterans. And the vibe is the same in that room. Everybody's happy to be there. And they're just so excited that, this is their chance at a step back to normalcy.
Well, I wanted to address a question that just popped up in the chat, and I was going to delete it, and just move on with my life. But I think it's actually important that we address it. The Wisconsin Veterans Chamber of Commerce is a non-political organization. We're not bipartisan. We're nonpartisan. We serve the Wisconsin business community. We serve veterans in our community. However, I think we all recognize that in many ways that there has been some divisiveness about COVID response, COVID vaccinations. So for someone who may have comments like, what we're doing right now is propaganda for an experimental vaccine, or someone that I'm assuming is not a pharmacist or a epidemiologist, or, saying that the vaccine is, who has doubts or is spreading doubts about this vaccine, about is it experimental? Is it effective? Has it been tested? Has it been verified? What would you say to somebody like Jeremy in the comments who has doubts and clearly very strong opinions about this vaccine and the way it's being rolled out?
Yeah. So, I think the first thing we need to acknowledge is yes, this did go through an expedited review process. It did not go through the normal processes that we're used to seeing with the longer term testing for vaccines that we would normally expect to see. Hence the emergency use authorization versus an actual approval from the FDA. I think a couple of things, though, that are really important to understand is, while it was an expedited process, they still did go through all of the normal phases of trials that any other vaccine, medication, anything goes through before it's approved by the FDA. There was incentive to do that quicker. There was also funding upfront that allowed the companies who were investigating and who were researching these vaccines to move through those phases a little bit quicker. Generally, they'll wait until they see their data before they move on. They had a funding source that allowed them to move quicker. So while it was an expedited review process, it still was a thorough review process.
Right on. So saying that this is an experimental vaccine would be misinformation, in that it's not more experimental than any other vaccine that goes through the whole process. This just went quicker because it had a ton of resources behind it. Is that accurate?
That is accurate, and we are still collecting data on it. So because it was a quicker review process, we don't have some of that long-term follow-up data, and we are still looking for and collecting that data. So we aren't administering it to people in the way that we would if it was truly part of the trial. We're sort of in that in-between phase where it's the FDA and the CDC have reviewed it. They've reviewed the data and said that they feel it's safe and effective, and that it's okay for us to move forward with it, while they do continue to collect some of that data, and hopefully we'll see a full approval soon.
So do you find that you run into a lot of this kind of misinformation? Is that a big hurdle for you in trying to get the word out and trying to get, especially those of advanced age and in at-risk categories, getting them the help that they need to get vaccinated? Are you up against the wall with just a sea of because I've seen so much fear and misinformation being spread around about this?
Yeah, vaccine hesitancy is definitely a real thing. And, I think it's important that people look at the information, and everybody makes a decision for themselves whether or not it is the best thing for them to get the vaccine. The approach we've taken is providing as much education as we can. We did it with the employees as we rolled out our employee vaccinations. We held regular education sessions and sent out information, and we're continuing to send out updates as well for veterans. So I think education is the key, focusing on the science and the data that comes out, and really sticking to that is kind of where we have decided is the most important, and working our hardest just to educate those people, and when necessary have the conversations for people who are more hesitant, and find out what their concerns are, and educate them to the best of our ability.
Right on. Now, do you, obviously there's some pretty high, and Jeremy, I see you got a handful of other thoughts on there, and appreciate your concern. We also had a question from Bill Meisel, who's a great guy. He said, "Are you hiring any licensed pharmacists?" And I think that's a really good question. I would assume that the rollout of this vaccine, especially as you get more and more and more doses, and the pool of eligible folks that are going to be on the receiving end expands. Do you find that you are resource shy? Are you currently looking for more licensed pharmacy techs or above?
At this point, we're not. We have been able to maintain operations. I will say my techs are pretty busy drawing up doses every day, but we have been able to devote some of our resources from other areas, as currently our outpatient pharmacy isn't quite as busy with fewer people coming in. So we've been able to reallocate some of those resources. So currently, no, but as things change, if vaccine supply suddenly starts to increase, that could change. But at this point, we're maintaining.
And I would encourage folks, if they are looking for, and let me look this up here. If you are indeed looking for, opportunities through the VA medical or VA system or any other state governmental opportunities, WISC.jobs. That's the official state of Wisconsin government job site. Which, I've seen things from the Department of Agriculture through the Veterans Administration and statewide as well. So, Bill, it doesn't sound like they're looking for any licensed pharmacists at the moment. However, to stay abreast of any opportunities that are potentially available, make sure to check out WISC.jobs. Now, what other hurdles? I know misinformation is a big hurdle, but what challenges are you currently facing? Is it a waiting game? Are you having a hard time just being patient because you want to help so many people? Are you waiting on more doses to arrive? What hurdles are you facing right now?
So we've actually been pretty fortunate with our vaccine supply. It's been pretty consistent over the last couple of weeks. So we know what we're expecting coming in, and we've got our clinics all set up to try to get that many patients in each week. So actually at this point, we're sitting pretty good. If supply were to increase, could we increase our capacity? Absolutely. But we seem to be in a pretty good flow at this point.
Excellent. You may not be able to speak on this because I know you're specifically at the Milwaukee VA Medical Center. Do you see any evidence of there being any other issues in more rural areas or statewide, or is the rollout pretty consistent across the board?
So I don't really have any of the specifics statewide. I know rural areas is a concern for everybody to make sure that we're able to get the vaccine. So we've mentioned we're vaccinating down here in Milwaukee. We've actually run some clinics up at our Green Bay clinic as well for some of our patients up there. They've done a couple of larger weekend clinics, and they're actually doing some clinics this week as well. So it's definitely something we have taken into account during our planning. And we continue to try to come up with ways to ensure that we are able to reach out to our veterans who live in the more rural areas.
So where can somebody go or follow on social or online or otherwise to stay to stay informed. I know you'll just get a phone call if your number's up, right? But aside from that, updates from your world, where can somebody go to see
Yeah,
those?
so we keep all of our social media outlets updated. So Facebook, Instagram, at Milwaukee VA is where people can search to find that. We post updates on not only our vaccination efforts, but other things that are going on around. People can also reach out to their primary care teams and let them know that they are interested. Even if they're not in the current group, they will put an interest note in so that when we do get to that group, we know to call them. And the other thing they can do is they can subscribe at milwaukee.va.gov for updates as we send them out.
Excellent. What other special circumstances would make somebody eligible for, if they're 65 and up, obviously, if they're an at risk in a health category, what if somebody has an unavoidable cross country trip, or they're required to fly because of some sort of service requirement? Or are there any other things that might make somebody eligible in advance of when they would normally be able to?
At this point, we're really sticking with the CDC guidelines of those over 65. And then there's a couple of other medical groups who we've been treating. So patients who are on chemotherapy, or dialysis patients, patients who live in nursing homes, as they're, we know, prone to poorer outcomes. So those are really the only groups that we're vaccinating at this point. And haven't really opened it up because we know we have so many in those groups we need to hit before we move on.
Absolutely. Wow, this has been super, super informative. If anyone has any other questions, the time is still, the opportunity is still there. I encourage you to please ask us some questions here. Throw it in the chat. I know we had a fair amount of comments from Jeremy there. Raging the gamut there. We had a question from Bill. If we have any other thoughts, questions, comments, concerns for Kim here, or any questions about anything that the Wisconsin Veterans Chamber or the Milwaukee VA overarchingly is up to, feel free to throw them out right now as we kind of round third base and make our way towards home base here. Now, Kim, is there anything that we left out? Is there anything that you want to share with us about your initiatives? Anything that y'all are up to or have coming up? Or I feel like we covered a bunch of stuff, so we may have hit it all.
Yeah, no, I think we did. I think for the veterans on the call, sign up, subscribe for our updates. They do come out weekly with what's happening with COVID vaccine, everything here. So that's really their best way to stay informed. We'll get out the information as quickly as we can. Like I said earlier, if they want to follow up with their primary care team, that's a great way to get information and get themselves either scheduled for an appointment if they're in that age group, or put on the list so that we can get them scheduled once we do start opening up the age groups.
Outstanding. Well, that sounds good. We got a message from Saul Newton, who is the executive director of the Wisconsin Veterans Chamber of Commerce and the founder, who's watching via Facebook. He says, Kim, thanks for everything that you and your staff are doing. And yes, I would like to echo that from all of us at the Veterans Chamber and our constituents and the veterans we serve and statewide. What you're doing is very important work, and we appreciate everything that you're doing to get everybody healthy and safe, and to get this state and our people and our economy and our social life, you name it, to get everything just back on track. Really looking forward to that. I especially after chatting with you today, I feel as if the light's at the end of the tunnel here, and we really are moving towards a brighter future here. So hang in there, everybody. Yep. Kim, thank you so much for your time. I'm going to ask you to hang on the line while I kind of give some parting thoughts and ideas here. We'll talk soon. Thanks again, Kim. So for everybody else that's still watching, make sure to please visit our Linktree, linktree.com/WI Vets Chamber, and visit us at wiveteranschamber.org. You can see all of our links. You can sign up for our newsletter. You can read our blog, all that fun stuff. Please, 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 please join us. And we wear a little bit of a different hat on all of our different social platforms. So follow us at Twitter, Instagram, Facebook, all that fun stuff, LinkedIn, so we can share a little bit different insights and bring a little bit of different value to you from different locations. So before I sign off, if you thought I was just going to leave you hanging with that one intro video, you were wrong. And I'm going to sign off and say goodbye with this bad boy. We'll see you next week.